Ever wondered how your body maintains blood pressure and fluid balance? Let's dive into the complex yet fascinating world of the Renin Angiotensin Aldosterone system, or RAAS for short. This system, as intricate as it may sound, plays a crucial role in your everyday well-being. It's like a behind-the-scenes maestro, orchestrating your body's response to fluctuations in blood pressure and blood volume. Before we delve deeper, let's briefly touch upon renin, a key player in the RAAS. Renin is an enzyme that, interestingly enough, kickstarts this important process. Produced in the kidneys, it sets the stage for the series of reactions that make up the Renin Angiotensin Aldosterone system, helping to regulate your body's blood pressure and fluid balance. Imagine a scenario where your blood pressure drops. Maybe you're dehydrated or you've been standing for too long. Your kidneys, the vigilant guardians of your blood pressure, sense this drop. This triggers the release of an enzyme called renin into the bloodstream. Renin, being the catalyst it is, sparks off a chain of events. It acts on a protein called angiotensinogen, produced by your liver and released into your blood. Renin chops angiotensinogen into a peptide called angiotensin 1. Scene script: angiotensin 1, an inactive peptide, needs a little push to transform into its active form, angiotensin 2. This transformation is made possible by an enzyme called angiotensin-converting enzyme, or ACE, found in your lungs. Angiotensin 2 is the star of this system. It's a potent vasoconstrictor, meaning it narrows your blood vessels, thereby increasing blood pressure. But wait, there's more to angiotensin 2. It also stimulates your adrenal glands to release aldosterone, a hormone that signals your kidneys to retain sodium and water. This retention further increases blood volume, and voila, your blood pressure rises. Angiotensin 2 is not the only player in this fascinating system. Meet angiotensin 3, a lesser-known but equally important component of the RAAS. Much like its sibling, angiotensin 3 also contributes to blood pressure regulation, specifically by aiding in the release of aldosterone. However, its impact is less pronounced than that of angiotensin 2. Now you might be wondering, how does angiotensin 2 transform into angiotensin 3? Well, this transition is made possible by the removal of one amino acid from angiotensin 2, a process facilitated by aminopeptidase enzymes found in our tissues. Although angiotensin 3 operates in the shadow of the more famous angiotensin 2, its role in the RAAS is vital. It helps fine-tune the system, ensuring that our bodies maintain a delicate balance of blood pressure. While angiotensin 2 may be the star, angiotensin 3 deserves its fair share of the spotlight too. In the next scene, we will recap and conclude our exploration of the Renin Angiotensin Aldosterone system. Stay tuned. Now, let's delve deeper into how we can influence this complex system. Certain drugs, known as renin inhibitors, play a significant role in this regard. They directly inhibit the activity of renin, thus reducing the production of angiotensin 1 and subsequently angiotensin 2. This results in less vasoconstriction and less aldosterone release, which ultimately leads to a lower blood pressure. On the other hand, we have ACE inhibitors. These drugs work by blocking the conversion of angiotensin 1 to angiotensin 2. Again, this reduces vasoconstriction and the release of aldosterone, helping to manage blood pressure levels. These inhibitors are often used in the treatment of hypertension and heart failure, and their effectiveness is a testament to the importance of understanding the renin angiotensin aldosterone system. By getting a handle on how this system functions, we can better manage conditions that affect our heart and blood vessels. So the next time you consume a renin or ACE inhibitor, remember the silent maestro, the renin angiotensin aldosterone system, and how these drugs are helping to keep your body in balance. After discussing the role of renin and ACE inhibitors, let's take a closer look at some specific examples of these vital drugs. First on the list is aliskiren, a direct renin inhibitor. This drug operates by binding to renin, effectively blocking it from converting angiotensinogen to angiotensin 1. By disrupting this initial step in the renin angiotensin aldosterone system, aliskiren aids in reducing blood pressure and the risk of severe cardiovascular events. Next, we have lisinopril and enalapril, which are both ACE inhibitors. They function by preventing the conversion of angiotensin 1 to angiotensin 2. This action reduces vasoconstriction and the release of aldosterone, ultimately lowering blood pressure levels. These drugs are commonly prescribed for the treatment of hypertension and heart failure. They are crucial components in our medical arsenal, helping us manage and control these conditions effectively. Remember, by inhibiting renin and ACE, these drugs are instrumental in maintaining our blood pressure balance, contributing to overall body homeostasis. So when you take these medications, appreciate the intricate biochemistry at work, all geared towards keeping you healthy. Now that we've learned about the role and specific examples of renin and ACE inhibitors, it's time to understand their impact on our bodies at a larger scale. These drugs do much more than just lower blood pressure. By reducing the strain on our cardiovascular system, they significantly decrease the risk of heart attacks, strokes, and kidney problems. In patients with heart failure, they can enhance the heart's ability to pump blood, improving overall quality of life. Furthermore, ACE inhibitors have been shown to have protective effects on the kidneys, particularly beneficial for patients with diabetes or other conditions that put stress on these vital organs. It's fascinating to see how these complex biochemical interactions translate into significant health benefits. However, like all medications, they come with potential side effects and should be used under the guidance of a healthcare provider. In our next scene, we will wrap up and provide some final thoughts on the renin angiotensin aldosterone system.